Welcome, everybody, to our chat with Emilie Simard, our CRE and certified respiratory therapist. We're going to talk today about pulmonary function tests, what they mean, how they do them, how to prepare for them, maybe. We're going to talk with the Keep Breathers about it. Emily's going to give us a bit of a background information. She'll tell us about herself and about the tests. And then we will have a discussion after. If you're joining us for World COPD Day, welcome. Hope you enjoy our chat. Welcome, Emilie. Thank you so much for coming and spending your time with us, sharing your expertise. We really appreciate it.
Thank
Hello,
you.
hello.
Hello, can you hear me?
Yep,
I will share my screen.
okay.
I've just requested
Yep.
share my presentation here. So first I will introduce myself. So my name is Emilie Simard. I'm a respiratory therapist and certified respiratory educator. I work at the Belleville and Quinte West Community Health Center. I'm employed here, but we run a regional lung health program across our region. We provide spirometry testing and education for COPD and asthma. So today I'm coming to talk to you about pulmonary function testing. As you probably know, the theme for World COPD Day this year is Know Your Lung Function. So this is the right discussion for us today. So we'll talk about why it's important to know our lung function. What are the tests that you'll be doing when you test for your lung function, and what to expect and how to prepare and different considerations. Okay, so why is it important to test our lung function? Well, it is a marker of our health. It can provide us opportunity for early diagnosis and early treatment, which is very important, and help us also provide a differential in diagnosis. So COPD versus other lung health disease such as asthma, pulmonary fibrosis, etc. We can do lung function tests to assess response to treatments and inhalers, and it helps us grade the severity of the lung disease as well. So what is spirometry? So there's different pulmonary function tests. So we'll start by talking about spirometry. This is the most basic and the most common test that we can do. And this one will always rule out COPD. This one, you measure how much air goes in and out when you breathe, and also how fast you can blow the air out. Okay, so you'll have nose clips on your nose, and it's just really just something that you hold with your hand. You probably know about the full pulmonary function test where you're in a little booth. I call it a telephone booth. It kind of looks like this, where some testing you have to close a door, and some other tests the door stays open. I'll talk to you about it a little bit later, but I just wanted to start with spirometry because it does give us a lot of information in terms of your lung volumes. And if we rule out COPD, then it gives us information and things to consider regarding maybe other lung disease. So what to expect for those appointments? So before it, you should expect a phone call reminding you to stop your respiratory medication. That's if you are doing a test for a diagnosis. Oftentimes, when you're doing follow-up pulmonary function tests, they won't ask you to stop your medication because they want to know how well you're responding to your medication. You can continue taking your other daily medications unless you're told otherwise. Avoid to smoke prior to your appointment, and also to be prepared to use your maximal effort to blow out and to breathe in. So that means make sure you don't have a big meal just before your appointment so that you can have space to breathe. Make sure that you're wearing comfortable clothing, again, for the same exact reason, so that you're not too restricted in your breathing. And the test will always be done with a trained healthcare professional, okay? And they will ask you to repeat the breathing maneuvers multiple times, just to make sure that they want to get a good average and accurate results. And this is a part of the criterias of if a test is good, you have to have at least 3 acceptable maneuvers that are also similar in volumes. So this is why they make you repeat multiple times. So full pulmonary function test, like you see on the pictures, the ones that you do in a little booth there. So they do multiple tests when you do the full pulmonary function test. They will do spirometry, which I just talked about. They will also test other lung volumes. So believe it or not, after you do that pulmonary function test where that spirometry, where you breathe out all the way and you feel empty, but they say, keep pushing, keep going, right? You feel there's no more air, but believe it or not, there's still air at the end of this, right? That's what we call reserve volume. And we measure this volume with the full pulmonary function test. Also with this, we can also measure the diffusion capacity of your lungs, the diffusion of the oxygen of your lungs to your blood. So important things to consider. This is it takes a lot of effort to do this test. So please make sure that if you feel tired, dizzy, or lightheaded, let the healthcare professional know. If you are in any discomfort, we may push you to do your maximal effort. We see you, we see your face, but we might not know how you're feeling inside. So just always let them know how you're feeling. And also, if you had a heart attack or a surgery in the past month prior to the testing, always let the doctor know or the technician. They might want to rebook this at a later date. Okay. And so I just put my little resources here that I took from the GOLD website and the American Lung Association here. Okay. You guys have any questions or anything?
So if we get you to take the unshare,
Oh, I'm sure.
stop share, I guess it's called, not unshare. And we'll ask you guys to unmute yourselves, and then we can talk about our experiences. I'm going to just ask the group, has everybody had spirometry? Has everybody had pulmonary function testing?
Yeah,
Both.
yeah,
Yeah.
many
Yeah,
times. You
yeah.
mentioned about the reserved oxygen left in our lungs. And if there's too much left, does that cause the CO2, more people to retain CO2? Or it's just not getting the oxygen circulated through the rest of your system?
Right. I'm not sure what causes CO2 retaining, to be quite honest with you, but measuring the reserve volume is not only oxygen, right? And
Right.
as you probably know with COPD, we tend to air trap, right? When you're not being mindful at breathing in all out, and there's air trapping, and eventually this volume is no longer usable, and it just stays there all the time. Okay, and that's what I was referring to as the reserve volume. Yeah. Yeah.
And so that's one of the measures they will look at.
Mm-hmm.
That's in
Yeah,
the more sophisticated
right.
pulmonary function test, which is the one that you do uh, in the booth. So, the reserved volume actually can be reused with the right inhalers, right? So
Okay.
when we bronchodilate, so your inhalers have bronchodilators in it, so opens up, dilates your airways, which helps move the air. So
Mhm.
what often specialists are looking for is that reserve volume gets smaller when you're on the right inhalers because you're letting all that air out. Does that make
So
sense?
yeah, so I'll just see if I got it right.
Yeah.
So they look at that reserve volume
Mhm.
one of the reasons is they can sort of see if the medication that you're using is effective.
That's right. Yeah. Yeah.
Interesting.
So what
Interesting.
is the purpose of the one where you have to pant, where they have you panting and then they block it?
Right.
Yeah. That
Oh,
that
That's
test measures
always a
your
challenge to do.
yeah, it's
yes.
weird.
Yeah, so that test
Very much
referring
so.
to you have your hands on your cheeks and you're blowing into you're panting 1 2 1 2 and then the valve blocks and you still have to pant. And that test, don't ask me how because I don't know how it measures it, but it measures the resistance in your airways. So resistance, phlegm in your airways, like things that blocks your airways, like phlegm, inflammation around our airways. There's little muscles, constriction, right? So it measures how obstruct or restricted your airways are.
They do one at a normal panting, and then they do one at a real fast panting,
Right.
which I always flub.
It's a difficult part of the test for sure.
I don't know why. I mean, your brain should tell you to do it, but for some reason, when that comes down, it's like something doesn't connect.
Yeah.
Right.
Yeah.
Right. Now,
It
Emily,
feels
one of the
strange.
yeah, I can imagine. I've never had
Yeah.
it done, but I can imagine. One of the things that you said, Emily, that I kind of, oh, I didn't know that, was that if you're doing follow-up subsequent sort of um, a reevaluation, that they won't ask you not to take your inhalers.
Mhm.
Is
Yeah.
Which
So,
I thought of you because I was pretty sure it was you that had said before, like that is when we talk about anxiety, that is an anxiety inducing event, thinking that, oh, I can't take my inhalers. So, you
Absolutely.
know,
yeah.
Absolutely. That was good news for me for sure. But I don't know if that's across the board with all docs, all respirologists or not, because I just started doing the spirometry in Belleville. And before that, I was in Kingston every time for full pulmonary function tests.
Mhm.
right,
So I'm not sure what he thinks about doing just the spirometry in Belleville now
right.
Mhm.
regarding what meds to take or not take.
So
Yeah.
I
maybe
guess
that, but
I'll have to phone him.
yeah, and maybe that is a good sort of question saying, oh, I heard I went to this talk and I heard that maybe if it's just a recheck, and that makes sense too. Like if they're looking at to see if what you're using is helping you, then being on the medications when you have the test,
Yeah.
is
Makes a
maybe
lot of sense.
Yeah.
Yeah,
yeah,
because at the time of taking no meds and having the spirometry done last time, 6 months ago, my
yeah,
lung function dropped 8%, 7%. So
right.
I'm just
So
not sure whether that was, yeah, I don't know. That's
mm,
scary, but I didn't feel like I had dropped that much in lung function, but
right.
that's what the test said.
Mhm.
And I
Right. So
hadn't,
whether, yeah, right. So whether or not that was, I would imagine that it's hard to get a good test result when you're feeling
Mm,
really anxious.
yeah.
yeah, yeah,
But it
Yeah.
also, that test helps to indicate if you have a lung infection or not, because if that FEV1 keeps dropping in a short time, then they know there's something going on.
Right.
right, right.
Right. Right. And that would be maybe more for somebody like you that's had a transplant in that you're regularly
Every
having
day.
your FEV1 that they can look at that trend, but
Yeah.
maybe not so much if you only are having the test once a year.
Yeah.
Exactly. Yeah.
Right? Like
Yeah.
so, yeah, it might not be as indicative of an
Right.
infection, more of a real change in your lung function.
Yeah. And
This Donna
just
probably has one of these as well. It's just a small handheld one that does our FBV1. So do that every single day. And for myself right now, I just have
Yeah,
to submit to them once a week.
right.
Um, I think maybe Donna, if you've started it, maybe it's daily that you're doing your submissions for
Just
your
needed.
different tests. Maybe
Yeah.
I can't.
Yeah.
It's been almost 18 months, and the things changed during that time. So
Yeah.
I'm picking my brain to go back 18 months,
yeah.
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 shake
Yeah.
out
Just
the
to
mothballs.
So,
clarify, there's so there's a possibility that your doctor will have you stop your inhalers, even though if it's a follow-up. But it's definitely important if you want a diagnosis that you don't have the inhalers on board, right?
Mhm.
mhm,
But often when I do follow up spirometry, I prefer with the inhalers on just to see, especially for when there's an asthma component, because as we know, inhalers are not really changing the lung function. They're helping manage the symptoms on day to day.
Right.
Yeah.
Right.
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 Keep the little capillaries or whatever
The
open.
airways open.
Yeah.
Um,
Right.
so so obviously for diagnosis, the doctor's going to refer for spirometry and then maybe pulmonary function. How often is it usually retested?
It depends.
Depends. Okay.
I'm pretty sure the guidelines are saying 1 to 3 years
1 to 3 years.
for
So if you're
testing.
really stable, then 1 to 3 years. If something's changing, then they might
Yeah, and in my
look at
patients,
it.
I would do yearly because I can see my patients more
Right.
often.
Yeah.
Um, or if I cannot see them within that year, if there's any changes in symptoms, and we know it's not a flare-up, but there's changes in symptoms
Right.
with the same inhalers, then I would recommend doing another spirometry. Yeah.
Right. Right.
Mhm.
Right. And so is it usually the family doctors can refer as well as specialists? So if somebody doesn't have a specialist, could their family doctor refer?
Yeah. Yes.
Yeah. Yeah.
Yeah. Full
Okay.
pulmonary function test
Yeah.
in our area at Belleville Hospital
Hmm.
or Trenton Hospital.
Hmm.
And then there's spirometry testing at the different team care base sites as well. Your
What is
doctor,
it?
so if your doctor is a part of a team-based care, so
Okay.
family health team,
Family
so
health
there,
teams.
there is
Okay.
there is spirometry at those.
Right. And
Uh,
so if you don't have if what if you don't have a family doctor?
Yeah.
Unfortunately, at this moment, unfortunately, in our area,
Yeah.
unless you're referred by a doctor from a walk-in clinic to
Okay.
PGH, I would assume, or
Emerge.
like
Okay.
QH,
Yeah.
um, to get tested. Otherwise, right now at this moment, our program is not
Right.
open
Right.
to the patients without doctors at the
And
moment.
so they
Yeah.
can't use a nurse practitioner for a referral, or do they qualify or not?
Yeah,
They do qualify.
Yeah.
doctors, nurse practitioners,
Yeah.
Okay.
and
Yeah.
specialists.
But
That's
chances
it.
are, if you have a lung condition and you're needing some kind of care, hopefully you're going accessing it through a walk-in or through Emerge, and they can generate that referral.
Right.
Yep. How long do you have to wait for that kind of a test?
Um, it depends again on the different
Okay.
clinics, right?
Yeah. Yeah.
So in our program, we try to keep it 1 to 3 months.
Okay.
Uh,
That's pretty good.
Sometimes goes above like four or
Yeah.
5 months.
Yeah.
Unfortunately, our hospitals are
Yeah.
lack of resources. I
Yeah.
think the wait is
Yeah.
is much longer than that, unfortunately.
Right. Right.
I had to wait a long time last time because it was at the hospital and
Uh,
their respiratory techs were all tied up with inpatients.
yeah.
So
Yeah. Yeah.
I was a
Unfortunately,
year. I was a year.
a
So
year.
Here.
Yeah.
Wow.
Yeah. Yeah. Hmm. And
Any other
so as far as so they use the test for diagnosis, they use the test to look to see if there's any the optimization of the medication that you're on.
Mhm.
Um, any other reason? I guess they could also look sort of in Pat's situation, whether there's infection brewing if you've had a lung transplant. Um,
Post-transplant?
Post-transplant, yeah, post-transplant, you have quite a few of these pulmonary function tests, spirometry tests.
Mhm.
Um, what else? So how long does an appointment take?
Um, about 45 minutes, 30,
Okay,
45 minutes for just the
okay,
spirometry. The full
yeah.
pulmonary function test, I would assume, is
Now you
longer,
you said not to eat a full meal, but you can eat like
of
a
course. Yeah, you can.
regular.
eat regularly. It's just what I was saying is like not huge meal to
Christmas dinner.
restrict the lungs, right? Like
Right, right,
um so that you have space to expand the
right.
lungs
Which
because
makes
you're
sense
taking
if
deep
your
breaths.
diaphragm's being impeded.
Yeah,
Yeah, yeah.
exactly.
So about 45 minutes, and
Yeah,
then
about that. Yeah.
double check to make sure if you should take your medication before.
Mm-hmm.
Yeah, don't smoke
Yes.
before, right? Don't smoke before because that affects your airways. Um, what
Do you
else
find
do we?
people continue to smoke after they've been diagnosed with the COPD or any other lung disease? Or do they try to withdraw from smoking?
So one of the things that I've learned through doing the smoking cessation courses and working with people who have lung disease is most people that smoke would like to quit,
Mm-hmm.
right? Many of them are thinking about quitting. A lot of them are actively trying to quit, but it's hard.
Yeah,
It's
I would
really,
think
really
so.
hard. So
It's an addiction.
it's absolutely it's an addiction, but it's also a kind of
Lifestyle. Yeah.
lifestyle, right? So,
Mhm.
it's not just smoking it's not just quitting smoking the cigarette. It's the whole
Yeah,
series of activities that
Grab the
are
coffee, grab a
aligned.
cigarette.
Because
Yeah. Or
especially when
have stress, have
you smoked
cigarette.
you smoked for like 50 years. So that's
Yeah,
been a part of your life for 50 years, let's say. That's
yeah,
part of you. It's part of who you
yeah,
are. It's part of like
yeah,
your everything that you do, right?
yeah,
So
yeah.
it can
And
be challenging.
very challenging. And I've had like, you know, discussions over the years with people that'll say they pick up the phone and they automatically pick up a cigarette, and
Yeah.
it's not even like a cognitive thing. It's just
and
kind of what
mm,
yeah. So
Say how many
it,
cigarettes in a day are habit and how many are actual cravings?
hmm
You'd be surprised
hmm
if it's just habit. You can cut in half if
oh,
yeah,
you're cognizant of that.
Yeah.
yeah, yeah,
Yeah.
yeah. It's a
Yeah, it's weird. It's
it's
wild.
it is wild, and you know what? It's part of culture. You know,
my
Yeah.
sister
it's still part of
decided at
behaviors.
81 she would stop smoking. She's now
Yeah,
90 at 81.
Wow.
yeah, yeah, yeah.
And I just, but I thought, okay, I'm happy because, I mean, she'd
Yeah,
had
it's
breast cancer when she was 48, and it took her till she was 81 to decide to stop
Oh
smoking.
my.
yeah. Again, if it was just, deciding to
Yeah,
quit,
yeah,
then if it was that easy, it's like anything, it's like exercise, right?
oh,
We
yes,
all know we need to do it, but it's
Yeah.
then actually doing it is the challenge. So,
yes, it
um,
can be.
we all need support for a lot of different
Yeah.
things. Anything
Absolutely.
behavioral and lifestyle, it's hard. It's hard to do the right
Yeah.
thing that we think we should be doing. Do we have any other questions about our pulmonary function tests? I think one of the big things is don't be afraid, right?
I'm
No, and
always stressed when I go. I this
Yes,
Yes.
yes.
I know
I
I'm
think because it has the word test in it,
maybe.
Yeah.
I want
You
to
right?
make sure
want to
that
Right?
do
We
so
think
numbers
well.
we
look
have
good
to
all the time, that
perform
nothing's
when
not
it's,
going on. Yeah.
yeah, we think we have
But
to
you would
perform when it's a test.
But you would think after you've done it once or twice that you wouldn't be quite so fearful, and that's not the
Mhm.
case.
No, not
The
No.
at all.
anxiety is just as high on the third, fourth, fifth test. And
Yeah.
it doesn't really make sense, but it is because of the lack of medication allowed. And
Yeah.
just because
Well,
Pat, how bad it feels when they shut that valve off,
Yeah.
and it's
yeah.
just all of that,
Yeah.
knowing what's
Do you think
coming.
do you think the other part of the feeling anxious about it is wondering what the results are going to be? What
Yeah.
do the
Oh,
Yeah.
for
results
sure.
mean?
Yeah,
Yeah, that's part
Right?
of
Like
it.
that's a
Big time.
challenge as
for
well.
sure. COPD is a progressive disease. So every time you go for one of these tests, you think, have I sunk farther?
Yeah.
Am I
Right.
farther along in this journey? Am I,
Mhm.
Right.
it's
Right.
very scary. It's a thought that it crosses my mind every time. Yeah.
Yeah. Yeah, and I
Good
guess
point.
one of the maybe things that if you could just sort of convince yourself to think about it, well, okay, finding out the information from this test is going to help in the management of my condition going forward.
Yeah.
So
Right.
knowing what we're dealing with can help with the
Mhm.
management, and you know that's a
Yeah. Yeah.
Yeah.
challenging thing for sure. And again,
For
if
sure.
if that was
Because
easy,
that
then
might mean giving up independence and it might mean asking for more help, right?
Yeah,
right,
Depending on what the outcome
right.
is.
Mhm.
So,
mhm,
we all don't want to give up our independence. And the
No.
sooner we have to do that, the worse it is. So,
Mhm.
yeah, that's another one you have to
Mm.
think. But it weighs, right? So you need to
Yeah.
have the information in order to get the help that you need. So,
Hmm.
yeah.
Yeah.
Hmm. Hmm.
And I want to say, like, in the end, it's a number, right? I want to say it's just a number. Yes, it is helpful for your healthcare professional team to treat you the right way, to manage your health disease the right way, to to help you um to help you better. But in the end, like we know smoking cessation is the main thing, and exercise, right? So you can feel, as long as you're managing your symptoms,
yeah,
right? Somebody that has 35% lung capacity might not, you put both two person with 35% lung capacity, let's say, and one is like having trouble putting their shoes on, or their
Hmm.
underwear on, and the other one's running a marathon like
Yeah.
Russ, right?
Yeah.
So
Yeah.
Right.
it's just a
Right.
number. It does
And
the
it's
number
so
doesn't
true.
define you. It doesn't define
It's
your
so true.
your daily stuff. Like, your independence
Yeah.
matters, and you will continue to get your independence as long as you stay active and
Yeah.
you
so
quit smoking, right?
when you do this test and you said it helps to diagnose, how do you determine whether it's COPD or bronchiectasis or emphysema or PF, or pneumonitis, or what? How do you tell from that test
Right.
what is what? Like,
Yeah, so I can tell you the difference between COPD and asthma, let's say. So you know how when you do strictly just spirometry, okay, the basic test, you do breathing test and you're given Ventolin, the
oh,
salbutamol,
okay,
okay, and then you do the breathing test again, okay. So they do, depending on your volumes, it does a calculation, and per that calculation, that ratio of how much air did you blow out in the first second on how much air total that came out. This ratio, if it's below 70, point 0.7, sorry, that means your airways are obstructed.
okay,
Okay, so we go with that. Okay, so if it is 0.7 after giving you the Ventolin, or below 0.7, sorry, after giving you the Ventolin, that is an indication or a criteria for COPD. It means your airways are obstructed.
you,
Now, when asthma comes in, that is when your volume changed significantly after giving you the Ventolin. Okay, so there's specific criterias.
right,
Now, bronchiectasis, you might have normal lung function.
Hmm.
You might have obstructed lung function. To really know this, I believe, is imaging.
okay,
Imaging can help us differentiate a lot of different lung disease as well.
mhm,
And then pulmonary fibrosis, the volumes would look much smaller. Okay, so it's the opposite of an obstructive disease, such as like COPD and asthma. Volumes are much smaller.
okay.
Hmm.
Thank you.
Oh,
Hmm. Yeah.
I
So
hope
they
I,
look.
I hope it
Yep.
wasn't too complicated.
No,
Yep.
no,
Yep. So the basics is they look at the amount of air you can blow out in the first second versus the total amount of air. They
That's right.
take those and they make a ratio, like a fraction. And
Mhm.
if that fraction number is less than 70%, they say, something wrong, maybe COPD. Then they'll do the test again with a bronchodilate with the rescue inhaler. And if that number changes, if it improves, meaning that the medication has opened your airways so you can get more air out, then they say, likely you got some asthma. Maybe you still have some COPD, but maybe there's some reactive part of your airways.
Yeah.
Is that correct?
Yeah, that's right.
Did I learn from you?
Yeah, you did.
And then, and then if they look at the pulmonary fibrosis, those people's their lungs can't expand, so their total volumes are going to be on
Smaller.
the low end when they look at they'll compare you to normal. Like they've got numbers to compare you to the sort of general kind of public, right?
Yeah,
General
and
population.
those numbers depend on your height, your age,
Right.
your sex, your ethnicity as well.
Right, which makes sense because somebody who's 6 foot tall versus someone who's 5'2", the size of our volumes are going to
Yeah,
be
like our
different, right?
body mass index thing, same idea, I guess.
Yeah, yeah, yeah. So they kind of look at compare you to what a normal for your body situation might
Right.
be.
Yeah,
Yeah,
because I
and
was
and then
diagnosed. Sorry, go
yeah,
ahead.
yeah. I was gonna say, and then also like there are other tests that they can do, like imaging, to look at things like bronchiectasis and
Right.
yeah, just to look at sort of what the structure of the lungs look like rather than the function of the lungs, right? Does that make sense?
Yeah.
Yeah, there we go.
Hmm.
Because
I
I
think,
was diagnosed with IPF initially. Well,
yeah,
and then, so my first PFT, they did give me the Ventolin just the once.
just to
And
see.
that just made me cough for hours and hours afterwards. And
Oh,
Mhm.
yeah, it
Yeah,
was horrible. I mean,
awful.
you cough anyways with IPF or PF, right?
yeah,
But
yeah,
that
yeah,
just triggered even more so. And I told the
yeah.
respirator, oh, that was a Ventolin. I thought, thanks a lot. So no, that
Yeah,
was the
but they
one
wanted
only
to make
time.
sure that they
Yeah,
knew really well, because if you did have an aspect of asthma in those lungs, then they could
uh,
add to
I-
your management. Now, I
yeah.
think, Shelley, did you have a question? Shelley and Donna?
Does it show the percent? They said my lungs are down to 17%. Is that what the PFT test shows you?
Yeah.
So
So
what
like
does that mean, 17%?
yeah, so likely the 17%, I can't say because I don't have the report in front of me, but likely that 17% is the number that we use to grade the severity. So where they took that 17% is called your FEV1, your forced expiratory volume in the 1 second. Okay. So when I say we measure different volumes, right? So your FEV1 is likely 17%. Again, I can't tell because I don't have the report in front of me. So that means 17% of what's predicted for someone, your age, your height, your sex, your ethnicity. Okay.
Right.
So compared to somebody the same age and height, you have 17% of air coming out versus on
Mhm.
100% kind of thing. Does
Right.
that make
So they
sense?
look at somebody
Yeah.
who is like Shelley, but not Shelley, and then they look at what Shelley has, and they compare yours to what the number they think on paper you should be based on research or whatever,
Mhm.
and then look at what percentage your lungs are functioning at, and that for you is
Yeah,
17%.
yeah.
That's good.
Does that make sense?
So is that the air that I'm blowing out, or is that the percent of good lung I have left?
The air that you're blowing out.
Okay.
Yeah.
So does
So
that mean another 83% of air stays in my lung?
Kinda. It's yeah, I see where you're going. I understand your question. So yes and
So
no,
just
because
to clarify before you, so they're looking at the first 1 second of blowing
yeah.
out though, right?
So
So it's not necessarily that all of that other air is stuck in there. It's just
Okay.
in the first second of blowing out, that's the amount that comes out,
Okay.
yeah, and
right?
you should be, or you should, normal is over 80%.
Okay.
Okay, so or mild is over 80% when
Yeah.
it's not obstructed. But you know, COPD is an obstructive disease. Your airways are obstructed, meaning it's harder to breathe out, right?
Right.
It's obstructed, so it's difficult to breathe out. You can't breathe out as fast. So
Right.
therefore
Yeah.
it's 17 because it's a severe state, right?
Yeah. Yeah.
Yeah.
Yeah.
Yeah.
So that makes it sound a little less scary, doesn't it, Shelley?
Kind
If
of.
it's 17%, you're thinking that's all the
Right.
lung capacity
Right.
you have.
Right. Yeah.
It never gets explained completely to,
Yeah.
to help you understand it. You hear those numbers and you think, oh my gosh, that's all I've
Yeah.
got.
Yeah.
Right.
True.
Right.
But
Right.
again, it's a number. It doesn't define you or how you feel, right?
Right. Right.
So
Yeah.
Right.
a normal person without a lung disease, they would be like 80% or higher with their.
That's right. Yeah.
Yeah.
Right. Okay. Okay.
Yeah.
Yeah. Yeah.
What else?
But
What other tests? What other criteria are looked at during these tests to see how progressed you are in this disease?
It's mostly the FEV1.
It is, huh?
Yeah.
yeah, it's the most predictive measure.
Yeah.
Okay.
Yeah.
We use this and like in terms of testing, but also we use how you're feeling. We use your MMRC score. I don't know if you know that, a modified score. So it goes from 0 to 4. 0, you're only breathless with strenuous exercise. 1, you're breathless going up a flight of stairs or a slight hill. 2, you walk slower than your peers.
Have to stop, take a
You
breath.
have to stop and catch your breath on flat surface. 3, you can't walk more than 100 meters before you have to stop and catch your breath. And 4, you're too breathless to leave the house or to get dressed. Okay. So we grade the severity not only by the number, just like I mentioned, it's just a number, but
Yeah.
by how you're feeling and what are your
Yeah.
symptoms, right?
Right.
Yeah. Yeah.
Yeah.
Thank you. Yeah.
So in
Yeah.
Toronto right now, they are trying out a new method.
Okay.
It's really quite neat. You have the clip on your nose, the same as the other test. The big difference is you breathe in slowly, and you never have to exert yourself. It's done with ultrasound waves. So you put the mouthpiece in your mouth and you just breathe normally the whole time, but you hold your cheeks, and then they get you to do some different things. But you feel a vibration at the back of your throat, and but you never have to breathe hard, or you're not exhausted when you're finished. And so when I go every week now, I have that test done first, and then the regular. And
What's it called, Donna? Do you know?
I don't know what the name of it is. Actually,
Next time you go, write it down.
yes, I will.
Is that in the PFT lab as well, Donna?
Pardon me?
Is that done in the PFT lab, the same area where the regular PFT is done?
Yes.
Or
yes. Right.
Not done in X-ray, but in the PFT lab.
Right where they weigh you. Yeah. But they said it would be most helpful for COPD patients.
Oh, okay.
Because it's hardest on them. to do the breathing test.
Right.
Yeah. So actually, I was offered the chance to bring it home for 3 months and do it daily. But it's a little bit time consuming and you have to have 2 people.
Okay.
And so I talked it over with Ron and he says, do you not think I do enough for you? Which is totally true. I mean, he's awesome. Yeah.
And that is such a valid question, like not but like a concern, like we can't overburden our caregivers.
Exactly.
Yeah.
Exactly. Yeah.
Yeah.
Because
So
he makes good soup, eh? He does. He makes really good soup.
that's cool. That's cool. So that's interesting that
Yeah.
maybe that's something that's coming down the pipeline, and right now maybe it's probably expensive, right? And so maybe right now it's reserved for a little bit more specialized, more involved cases, maybe. But yeah, interesting that things are always developing and changing, and new
Exactly.
technology for sure.
Yeah.
And really, the more that you kind of know about what you are dealing with, the better you can cope, the more informed decisions you can make, right?
Yeah, exactly. And it
Yeah.
seems when you're in Toronto, you see so many different things and there's so much to learn. But the feeling that me doing that test myself, like I thought, oh my God, why didn't they have this when I got this? And I wouldn't feel horrible when I left and tired out for half a day.
Yeah.
Yeah. Yeah.
It takes a lot out of you going down there when they're doing different tests all in one day.
The other side of that, though, is knowing that you
You're
are
getting
able to
stronger.
do that, and that they are gathering lots of information and helping you to be able to have the best management with best outcomes possible. I just want to be mindful of the time.
Yes.
Does anybody else have anything else to add, to ask about the pulmonary function test? I think the main thing that I get from talking with Emilie is that it is an important test to have. Um, if you are anxious about it, talk to Emilie, talk to the provider ahead of time, talk about managing the medication part, whether you need to stop, not take it or take it, and then look at it from the point of view of it's good information to have to help manage your care. Whatever the results are, it's going to help mold how you manage going forward.
That's right.
Can I say one thing?
Yeah.
One lady said to me when I was having the test done, she said, remember, this is not a pass or fail.
Absolutely.
Definitely.
So I thought that made me relax.
Yeah. Again, it's about gathering information. It's not about making a grade.
Right. Indeed.
Yeah.
Yeah.
Yeah. Well, thank you, Emilie, so much for sharing your expertise and your time. I know you're such a busy lady, but we really, really appreciate it. And I'm sure that this little chat will help lots of people, not only in Keep Breathing, but the whole anybody who watches it for World COPD Day.
Yeah, that's great. Thanks.
Thank
Thank
you.
you for giving me the opportunity to be a part of this.
you.
That's great.
Yes.
Thank you, Emily.
Okay, bye,
Thanks,
guys.
Emilie. Bye.